My name is Linda Dixon, and I'm the Health Law Director at the Mississippi Center for Justice. Thank you for attending this press conference this afternoon. Participating organizations are the Mississippi Center for Justice, the Children's Defense Fund, the Mississippi Low Income Child Care Initiative, the Mississippi Black Women's Roundtable, the Mississippi Health Advocacy Program, the Mississippi NAACP, One Voice, Planned Parenthood Southeast Advocates, the Southern Poverty Law Center, the Southern Rural Black Women's Initiative, Southern Echo, and the Mississippi Human Services Coalition. And the Mississippi Immigrants' Rights Alliance. At this time, you will hear from Vangela Wade, President and CEO of the Mississippi Center for Justice.
Thank you very much, Linda. Good afternoon. Mississippi Center for Justice is standing with the 12 other major nonprofit organizations standing here today to give voice in support of Mississippi's most vulnerable citizens. 3 weeks ago, former Department of Human Services officials and their agency contractors were arrested for stealing millions. Should I repeat that? Arrested for stealing millions from the Temporary Assistance for Needy Families, otherwise known as TANF program. This is a public benefit program, public funds meant to help Mississippi's most vulnerable children and families. Instead of fighting fraud and abuse where it actually occurred and making sure that this never happens again, our elected officials are targeting the victims of Davis and Mute's fraudulent criminal activity. They are targeting the victims, our low-income women, children, elderly, and disabled citizens who are in desperate need of TANF funds, Medicaid, SNAP, and other vital public benefits to afford basic human dignity, to afford basic affordable care, groceries, and other basic human needs. In wake of the former DHS's executives and the contractors' TANF embezzlement scandal, Senator Harkins, Senate Bill 2257, and Representative Lamar's House Bill 749 seek to allow the Office of the State Auditor to audit the state tax returns of public benefit recipients. State auditors and lawmakers are going so far as to claim that federal law mandates the audit of Medicaid beneficiaries' tax returns, even though no such federal mandate exists. Let me be very clear. Beneficiary fraud is very rare, extremely rare. There are existing prevention and detection measures and current data sources for eligibility audits already in place. Moreover, the Division of Medicaid has determined that tax returns are an unreliable data source for verifying eligibility, and that relying on better data sources to detect rare cases of beneficiary fraud is preferable. Likewise, the Department of Health and Human Services, the federal agency in charge of fighting healthcare fraud and abuse, does not use tax returns in Medicaid eligibility audits, choosing again to use more reliable data to detect abuse. The question that is foremost in our minds today is whether the only reason for these discriminatory proposals, discriminatory bills that are snaking their way through this legislative session is just a way to target the families, the beneficiaries of these basic human needs, the funds to support these basic human needs, as opposed to focusing on the embezzlement of state funds. At this moment in our history, Mississippians deserve governmental accountability and transparency, not more smoke and mirrors or confusion to stand in the way of basic human necessities. In times of crisis, public benefits provide life-saving relief to Mississippi's most vulnerable children and families and disabled persons. Cruel and baseless attempts to dismantle public benefits and fabricate federal mandate to heighten barriers neglect the urgent needs of Mississippi's most vulnerable. Now more than ever, we urge lawmakers to put people ahead of politics and focus on ending fraud and corruption where it actually exists. The legislative response is irresponsible, and it further oppresses and or targets the poor by proposing this unnecessary and baseless audit of tax returns of TANF beneficiaries, but not proposing anything that would reform or build oversight into the system that allowed embezzlement to occur in the first place. Unfortunately, these bills, again, snaking their way through the halls of this legislative session, along with MDOC's Parchman debacle, is very emblematic of Mississippi's pathologies, policies, and practices negatively and detrimentally affecting our state's most vulnerable citizens. So basically, we have the same impact, the same intent, just dressed up in different suits. I'll introduce you to Ms. Lita Fitzgerald, Director.
Good afternoon. My name is Dr. Corey Wiggins. I serve as the Executive Director for the Mississippi NAACP. And I stand here with my partners, our partner organizations with us today, also representing NAACP members all across the state to make sure that people understand, the folks in this hall, the folks who are making the decisions understand that the people of Mississippi are watching. We are watching as you are attacking our public benefits. You are watching as you are attacking families and communities who are most in need. We are also watching as you are making decisions, and those same decision makers are making sure that their friends and their allies are making money off the backs of those folks who are most in need. And we are not going to stand idly by while these things continue to happen. We are excited, we are here, we are watching Mississippi. We continue to watch the decisions that are being made in this body, and knowing that those decisions are not being made in the best interest of the citizens of Mississippi. So I stand here today on behalf of NAACP members across the state of Mississippi, and I stand here as a citizen of Mississippi, letting folks know, letting this body know, and the leaders of our state, that we continue to expect more, we expect better, and do not attack citizens across this state who are most in need. Thank you.
Thank you, Corey. At this time, we'll hear from Brandon Jones, Policy Director of the Southern Poverty Law Center.
Thank you. As you heard my colleagues say, just a few weeks ago, just earlier this month, we sat by and read news stories as we heard about the folks who were charged with doling out services to Mississippi's most in need families, Mississippi's working families, were caught with their hands in the cookie jar to the tune of millions of dollars. It is astonishing that the Mississippi legislature, in response to this dark moment, has, rather than putting in safeguards that watch the watchers, that watch the folks who dole out services, and remove some of the barriers that keep some of our hardest working families in Mississippi from getting the relief they need. Rather than doing those things, we instead have gone and rolled out an excessive and arbitrary audit that will require many more hoops to jump through for the families that need these services the most. This is a time when the legislature should undoubtedly be finding working solutions for working Mississippi families and not placing additional layers of bureaucracy between these working families and the services and the need and the assistance that they desperately need. the Southern Poverty Law Center is happy to join some of our partners and Mississippi's working families to say that the legislature needs to use this time to work on solutions that bring those families in need closer to the services that can change their lives. And say no to these wrong-headed bills that create additional layers of bureaucracy and bring people farther and farther away from an economic reality that would lift up the entire state. Thank you.
Good afternoon. We're happy to be here with our partner organizations that work with the families that will be impacted by the policies that are rolling through this legislative process on a daily basis. We're talking about, in some of these proposals that are moving, when you talk about SNAP, when you're talking about food that poor families need, when you talk about Medicaid, you're talking about children and the elderly. Nobody else is pretty much eligible for that program. So when we put up blockades to make it more difficult for people to apply for and receive benefits, we are in essence creating obstacles for them to receive those benefits, much like what happened in TANF. How did TANF happen? How did this happen? Many of us, for years, have been asking for oversight and transparency at the Department of Human Services, not just in this past administration, but in administrations from the beginning when TANF was implemented in 1995. We got very little doubt, but what we did know was that TANF, the federal program which was to ensure that families were helped to move from welfare to work, was not happening. That families were moving from welfare, but the connection to work was not happening. We also knew that TANF came to Mississippi as a block grant. There are block grants all over the country. What happened in Mississippi is a result of the fact that TANF was turned into a block grant. And it gave the administrators the position to allow that program to operate as a slush fund. It has operated as a slush fund in the past. None of us standing here believes that the people that have been brought before justice for what happened with the TANF funds, none of us believe that somebody's budget went from $2 million to $136 million and nobody knew it. John Davis is not the titular head of what happened at DHS. The danger of TANF and the danger of many of the proposals that we see moving through this capital at this time, which are egregious and which seek to criminalize the people who need the services the most and turn your head away from the criminals that are taking advantage of programs that are supposed to be there for children and families. Over 27% of the children in the state of Mississippi live in poverty. 14% of white children live in poverty. This is not a race issue. We have poverty in this state that crosses all spectrums. So when you start making it difficult for somebody to get health care, which is what you're making it difficult for, a person receiving health care gets no cash benefit. If there's fraud and abuse in the Medicaid program, it is at the provider level. It is not at the level of the person needing the help. The only thing a person gets from Medicaid or CHIP is an opportunity to go to the doctor. So where is the theft there? Why are we making it more difficult for these people to apply? Why do we only have a few families on TANF? Because they have implemented rules that make it more difficult for people to get approved. They're doing the same thing now and seeking to do that with SNAP and with Medicaid. So you don't want people to have financial assistance. You don't want people to get connected to education or to GED programs or to child care or to transportation, but you will allow somebody to walk away with $136 million that were intended for those families. We work with families every day that are trying to make their way out of poverty. And then it is just egregious, it's immoral for us to stand here and see people steal money like that. If these proposals that are moving through, as we talked about, block granting is the most I can't even say, it's the most dangerous thing we can do for our tax dollars. When you turn all of your tax dollars over to one person to be in charge of how a program operates, that's dangerous. Programs have rules. Federal programs have rules. There are things that are put in place to make sure, as my partners have said, that people cannot steal benefits that they in fact need if they are trying to get them, because obviously they need them. Mississippi is the poorest state in the union. Instead of us looking at ways to spend TANF dollars, and there are proposals that are moving through that propose ways, better ways that we could use the TANF dollars. We should not look at this as a one-off, that this happened and it's not going to happen again without things put in place to stop it from happening. So we need to talk about how we can better spend TANF dollars so that we can move people out of poverty. Mississippi is one of states with the highest rate of hunger and food insecurity in the nation. Why are we wanting to use tax returns to keep people from applying for food that they need? When you know, the question was asked, what's wrong with that? What's wrong with that is that you have all other ways of trying to see whether or not somebody is creating fraud in these programs. Two, if you got to go somewhere and find somebody's tax return, how long does that delay a person from being able to access benefits? How hungry does that child have to go while you're trying to find their tax return somewhere? And that's cumbersome as all get out. Why is the state auditor put in place to audit eligibility when all of these people have programs? Why was TANF operated through a nonprofit organization the way it was when we have TANF staff in every county in the state of Mississippi? I close with, we know what's going on here. We have been talking about what's going on here. They are in charge. If you think what happened to TANF is bad, turn block grant Medicaid. When you look at the amount of money that's in Medicaid and the amount of money that's in TANF, and you turn it over to somebody to use as their personal patronage, that is criminal. We should not walk away from that. We should not put that kind of power over that kind of money, over our money that we pay taxes, that we pay in taxes. And it's there, and it's stated that it's here to help vulnerable families, children, and the elderly. And we turn it over to these people, and they do all kinds of things that we have not heard but the tip of the iceberg about. And I close with this. There is no way that any reasonable thinking person would think that somebody would get $136 million in funding through the state government and the governor does not know it. If he doesn't know it, he's a sorry politician.
All right now.